there's a lot to talk about, but
Yeah.
I want, before we get started, I want to thank you for your commitment and your leadership at Vidant Health System. Because I'm telling you, I sing your praises all the time, and I haven't always felt that way about what goes on at Vidant Health. But I'll tell you, under your leadership, some incredible things are in the works. And I got to give you a lot of the credit for it, because you are the background that you have is the perfect kind of background for this system here. But beyond that, the integrity that you bring to the job and the personality and the way that you deal with people in the community, I just got to tell you, we got to thank you for that.
Wow.
In my opinion, you're a rock star.
Well, I'll take all the blame, but I really give the credit to a great team, and we have incredible staff and professionals, community physicians, the ECU physicians, and Vidant Medical Group physicians, and all the staff. We just have a fabulous team across Eastern North Carolina doing really great work every day. So it's a real honor to do that work and work with them. So they really deserve all the credit. I appreciate the words, though.
You've got some interesting things going on in 2017, but let's review 16 a little bit. You had some challenges in 16. We had one of the biggest weather events we've ever had. It wasn't quite as didn't quite affect us as much as Floyd in '99, but Hurricane Matthew was a big deal, and I ran into Brian Floyd, who reports to you as president of the local hospital here. And Brian was telling me about the way that your employees and people on your staff reacted to that and what everyone went through during the hurricane. And I just wanted to give you a chance to talk about that.
Well, I really appreciate that. So it was in last calendar year, but it was at the very beginning of this fiscal year. And so it was a historic event and impacted really Eastern North Carolina profoundly. And we provide care really in a lot of those communities, and it was a really devastating event for so many people that continued to try to recover from a significant impact. And so we felt that it was important that we do everything we can to support those communities, to support our employees, because our employees, we are the community. And so our folks, our teammates that were stressed and impacted significantly because of the storm. We've tried to reach out and support them financially and with other support. And so the team has really, I think, done a great job in doing that, and we feel like it's important that we do that. And people are still struggling from it. So I think it's one of those things that if you go in some of the communities in Eastern North Carolina that were flooded, they're still really working hard to recover. So I don't want us to forget that, but we're going to recover from that from a company perspective and move into a great 2017. Healthcare's going through a lot of changes. There's a lot of chaos in the world and in healthcare right now, but we're going to concentrate on doing what we do, which is take care of Eastern North Carolina and make sure we do it with the highest quality and the highest integrity every day for everybody. So that's what we're concentrating on.
We appreciate that. And of course, you can't talk about Vidant Health in 2016 without mentioning Belhaven. Belhaven has been a challenge. You inherited that when you got here, and there's been a lot of really, I think, unfair things said about people at Vidant Health about what took place at Belhaven. But what you have in Belhaven now is a terrific clinic.
We have great staff. We have a state-of-the-art facility, open 24/7, 365. And it really is the type of solution that a community that size needs. There are many, many communities in Eastern North Carolina and in rural America of 12 to 1,500 people that would love to have a facility like that. In fact, I've gotten calls in towns that don't have things like that and asking for facilities and staff to be put in their communities. So we're really proud of what we're doing. I'm not entertaining conversation about the political side of it. We're just, like I just said before, we're going to concentrate on what we think is important, which is taking care of people in Eastern North Carolina. Our staff concentrate on that every day. And so we're in process of invigorating that and transforming in a rapidly transforming healthcare industry to make sure that we're here in Eastern North Carolina, that we're successful, and that we meet our mission. So we're proud of what we're doing.
And you've taken the high road from day one on this, and I appreciate your ability to do that because I know it's been hard. But to the people of, but we have a huge listening audience in Belhaven. To the people in Belhaven who have been told this or that, I mean, what would your message be to the folks in Belhaven today?
Well, that we're there and we're going to stay there and we're committed. We've invested $6.5 million in Belhaven, probably the largest investment in that community. Any town that has a company that invests that kind of resource, it shows our commitment. So, so we're there, and that's what we're doing. So we're letting our actions and demonstrate, what we're about. And I can't talk about 3-4 years ago. It's all interesting history, but I'm concentrating in the future.
Right, and we appreciate your position on that. Let's talk about 2017.
Great.
We see that huge tower going up over there.
Yeah.
I mean, it's so exciting because, if you live here and you've lived here as long as I have, I've been here, I left, I came back. I mean, the metamorphosis has taken place.
It's phenomenal.
With the Vidant Medical Center campus is just off the scale. It's something that no one could have ever predicted. I don't think, even back when Dr. Leo Jenkins had this dream back in 1975 when the medical school started. But the cancer center is the new part of it. I believe it's $80 million.
It's close to $200 million project.
$100 million?
200.
$200 million.
Yes. So and back to what you said, I think the phenom we have here, the phenomenal organization that is now Vidant Health, is really attributable to that dream and the fact that we have ECU here. And this doesn't just happen. To have medical capabilities that we have is because of our partnership with ECU and because ECU, Brody School of Medicine, is there. If that did not happen, we wouldn't be here. So, and then we're going into that future in the Cancer Center, which is an exciting project from a lot of perspectives. Gives me a lot of anxiety because it's a big investment. But that investment's being made because of the huge need. Unfortunately, cancer is the #1 killer in Eastern North Carolina. There are many people, families that are impacted with that devastating word and disease of cancer. I personally have had it affect my family significantly, and so I know how difficult that is personally. And so we're looking at that facility as a physical asset with state-of-the-art facilities so we can bring the best physicians to add to our current excellent team. And to build the programs for Eastern North Carolina. But it is about the system of care for Eastern North Carolina. We have great cancer care in all of our hospitals across Eastern North Carolina. And so this is part of that plan to build a system of care to take care of people with this devastating disease that just affects way too many people in Eastern North Carolina.
And we already see the model. I mean, when I grew up in northeastern North Carolina, and of course people who got cancer, who got very sick with cancer, I saw them having to make the 3.5-hour trip to either Duke or Chapel Hill. And of course, now we have an incredible heart center here with some of the top heart surgeons in the world. Is that the dream now, to turn, to kind of emulate what you've done in heart surgery and cardiac care with this cancer center for that disease?
Somewhat, and also to push that, what you described is so true, and what we know is some people won't make that 3-hour drive. Some of them won't make an hour drive, and that means they die of their disease. And so we're pushing it not only to Greenville, but then pushing it out into the communities we have. So, for instance, the system of care for cancer care includes the cancer centers and facilities in all of our hospitals that we've spent a lot of resources upgrading those. And they'll be all hooked together to the cancer center with a team that may be geographically spread out, but their care is coordinated. So if you need state-of-the-art therapy dictated through research and through the advancements that our excellent cancer physicians here in Greenville have, they can push that close to your home in the community you live. And so, yes, it's part of that, but it's even to push that further out into our communities because we really need to support the care where people are, and that's where they live.
Dr. Mike Waldrum, the Chief Executive Officer of Vidant Health, our guest here this morning. We're hearing more and more about this thing called Operation or Project Unify. I was fortunate enough to be over at the Hilton last week when you and the Chancellor from ECU Cecil Staten gave a presentation to about 200 people over there. I encourage people to learn more about it, to know more about where we're going. It's the next step here for healthcare and what's happening with Vidant and the Brody School of Medicine. I can tell you it would not happen without your commitment to ECU and without ECU's commitment back to Vidant. I feel better than ever that we have two leaders in yourself and Cecil Staten at ECU that can chart a course for the future that will keep us strong here in healthcare and take us even to the next level. But, you know, we're here in Operation, I keep wanting to call it Operation, Project Unify. Tell us exactly what it is and how it's going to affect not only what Vidant Health does to provide care, but the Brody School of Medicine.
So it is about aligning the two physician practices together, so putting them together. So I first want to say what it's not. It is not selling Brody School of Medicine and ECU. So the School of Medicine's function is to educate future physicians, and they do that better than really most, and in some categories they're the top in the country, and I think people need to recognize what they do. So it's not about educating the future physicians. It's about taking the practice of medicine that is done inside the Brody School of Medicine and putting it with the practice of medicine that Vidant Health physicians do, so that they literally can plan together, strategize together, and put new systems of care in together, which is there's laws that prohibit us from sitting in that room and doing that kind of planning. So sometimes just inadvertently we would make separate decisions and could compete with each other.
Let me stop you for a second, because most people think Brody School of Medicine and Vidant are already together, that, you know, because when they go to the hospital, they see doctors from the ECU physicians with the Brody School of Medicine coats on. They actually see those doctors. They might see Vidant Health coats. So as I understand it, there are doctors that work for Vidant Health and different doctors that work for the ECU School of Medicine. And what you're talking about doing is bringing them together into under one roof, right?
Correct.
Okay. And how does that differ from now?
Well, they literally aren't together in that way. So if you bring, just like in any group of people that are trying to do something, if you bring them together where they're funded and governed and plan, and they're putting in new programs together, meaning so what I mentioned, there's some laws that prohibit us from sharing money or sharing plans from anti-competitive reasons and things like that. So we don't sit in the same room and plan the system of care.
But this would allow you to do it.
This would allow us to do that. And so it helps invigorate the clinical care practice in support of ECU Brody School of Medicine. But I want to be very clear that Brody School of Medicine needs to grow, and we're not taking the responsibility of funding the education of future physicians. That's still the what traditionally has been the role of the state, and that's not what we're talking about.
So the ECU will continue to educate the doctors, but this will be basically the business of medical care that the doctors provide to Eastern North Carolina.
Correct. And it's a very unusual structure. The ECU physician structure is, the way we're organized, it's the only one like it in the state, and it's similar to UNC, but we're different than that structure.
There are a lot of misconceptions out there
complex
about it. Let me throw out a couple of things that you're going to hear as we get closer to this becoming a reality. If you've got two different doctor groups now and you put them all under one roof, isn't the cost of medical care going to go up without that competition?
Well, actually, it's the opposite. So most of our funding and the way we're funded in healthcare comes from the government. So the price is set, and
so you can't determine what it costs for a service anyway.
Well, we get paid a certain amount, and so the job is to, if your price is set, you want to provide it as efficiently as you can so that you create a margin. And so it's really about meeting the demand. We have a huge demand for services, and I think that how we improve access and how we improve care is really what it's about. And you may have heard the term value. The healthcare is being funded more and more on the terms used value, and so that's the cost of care divided by the quality, and so we are being pressured as an industry to constantly look at improving quality, which we have a great tradition of doing, and constantly decreasing the cost of care. So those structural issues aren't going to change because of Project Unify. Those are national and state initiatives on how we're getting paid.
We unfortunately we're run out of time, and I apologize. I got many more questions, but the timeline on this, is it going to happen in 17?
Well, we hope so.
Yeah, still working on that.
Yeah, we're working hard. There's as you mentioned, the leadership. We have hundreds of people inside ECU and Vidant working on this because they're excited about building the new model for rural health care, so we can show the country it can be done. We feel it's our professional obligation to do that. People are excited about that. It's a scary thing. Change is always hard. But the leadership at ECU, the leadership at Vidant, the respective governance organizations seem to be very supportive. So we're hopeful to carry that through that decision-making process and have it together here pretty quickly in the next few months. But that's when the real work begins, because we're going to be building a new system of care that we can demonstrate that we can be that model.
And is it true, after complete, it will be the largest doctor's practice in the state?
It will be one of there'll be maybe one other one that's larger.
Okay, interesting.
Yeah.
Thank you for coming.
Thank you
Good
for
to
having
see
me.
you. Appreciate that. A lot of great things happening at Vidant Health under your leadership.
I appreciate it.
Good to see you, Dr.
Good to
Mike
see
Waldrum.
you.
Yeah.